My name's Oliver Seligman. I'm 49 years old and the author of Befriending Bipolar, A Patient's Perspective. And I was diagnosed with bipolar type 1 when I was 17. Looking back, I did have certain signs that I might have bipolar or mental problems when I was younger. I experienced quite a lot of anxiety. My mind, which these days is pretty quiet, was very, very busy and very, very agitated and neurotic. I found it incredibly hard to relax. When I first started implementing ketogenic therapy, very quickly I noticed a change. And I noticed this kind of calmness descending over my mind and my body. It was like breathing a huge sigh of relief. It's like, oh, that's nice, you know. And that was a very, very cool experience. And that immediately gave me hope. There's something to this. For the first few weeks, I just had this sort of calmness and being grounded, and I struggled a lot with trying to measure out the diet. It was very strict because it was a research study. But then after 3 or 4 weeks, I noticed that the side effects of lithium were getting worse. And so I spoke to my doctor and decided to lower it a bit, and that worked a treat. And that was really when I started to notice the cognitive changes and the clarity and the ability to use my brain when I hadn't really used it for 20 years, to be honest. I do think that the potential for keto to put a high percentage of people with bipolar and other illnesses into remission is very high.